Welcome everybody. This is Nurse Fafan from Essential Nursing Academy. Jeudi à nous allons faire un skill qui est using the bedpan while the patient is in bed, okay? Nous allons utiliser bedpan pour patient capable pipi ou bien pour soit pour capable faire besoin ni n'importe ça le pendant que patient sous cabane. Ça c'est un skill qui require pour tout CNA master et puis pour capable connaître qui j'en pour faire après ça pour faire certification pour capable commencer à travailler comme CNA dans state côté autorité. All right? Nous allons commencer ensemble avec ce skill là. Oubliez, avant tout skill commencer, ça n'a fait, n'a lavé mais nous, hand washing, okay, is required, hand washing is completed, et puis les fini pour nous commencer skills. Let's go. This is the bed. These are the two different bed pans, okay? This is a regular bedpan and this is a fractured bedpan. Bedpan ça yo utiliser pour moun qui fait opération dans hanche, opération dans dos. Okay, it's called a fractured bedpan. All right, c'est lui même moun sa utiliser là fin faire opération. Mais je dis on a pu utiliser ça. Okay, we're gonna use the standard bedpan today. All right, ça c'est femme qui utilise, garçon eux même ils utilisent l'autre bagage qui est le urinal. Je dis on va utiliser bedpan là parce que son patient femelle nous gagne. All right, we're gonna need a blue pad. Okay, we're gonna need blue or green, whatever. We're gonna use this pad for our patient to cover our primary sheet. Hi, Mrs. Ali. My name is Stephanie. Today, I'm your CNA today, and I understand you press the call light and you need the bedpan. Okay, I'm gonna help you with that. All right. For a bedpan, you don't need to check a ID band because anybody can call for a bedpan. Anybody on the floor. It doesn't matter if it's your patient or not. They can call for a bedpan. So you do not need to check the patient's bed ID band for a bedpan. All right. Remember, hand wash. We provide privacy for the patient. All right. Don't forget the state board. With the state board, it's very important to touch the curtain and provide privacy. The evaluator wants you to do that. They actually want to see that. All right. They want to see you doing that. Okay. To touch the bedpan, you don't have to wear gloves, but I'm going to wear gloves because I don't know if the bedpan, I don't know, but I can wear gloves, so I'm gonna wear gloves. It doesn't hurt to wear gloves to use the bedpan. All right. Okay, I'm gonna put the patient's bed up. Make sure you use good body mechanics when you're doing this. If the bed is low, you don't want to strain. You don't want to put too much pressure on your back. You have to raise the bed to the level that's comfortable for you to do the skill, okay? As a CNA, you're going to be doing a lot of bending and lifting and turning and twisting. You need to protect your body. So therefore, we're going to raise the bed to our level to make sure that it's at an appropriate level for you to get the skill done. All right, Mrs. Ellie. I'm going to uncover Mrs. Ellie and I'm going to ask the patient to turn. All right, Mrs., can you please turn for me? Okay. All right. I'm going to use that pad. Okay. All right. You can come back. And I'm going to retrieve. All right. Okay, there is another way that I can do that as well. I'm going to use the blue pad. Okay, I'm going to use the blue pad. Okay, I'm going to ask the patient to lift. Can you please lift? Thank you. For this patient, she's okay to lift for me. So that's what we're going to do. Okay. Okay. Now we're going to use the bedpan. All right. Can you please turn to the side, Mrs. Ellie? Thank you. All right, to make sure, for comfort, make sure that the bedpan is used like this for the patient. Ou pas tomber. All right. And she's gonna come back. All right. All right, I'm gonna put the patient head up. All right. Here's your call bell, Mrs. Ellie. I'm gonna give her the toilet paper. When she's done, she's going to call me so I can retrieve the bedpan, okay? All right. Mrs. Ellie's done. She calls me already so I can retrieve the bedpan for her. I'm going to take the call bell and the toilet paper from her. She has already used the toilet paper. Mrs. Ellie, can you please wash your hands for me? All right. All right. Thank you. I'm going to put her head down so I can retrieve the bedpan. All right. Mrs. Ellie, can you please turn this way for me? All right. Okay. All right. So we got the bedpan. We're going to cover the bedpan. Okay. We're going to cover our bedpan. We're going to cover everything and take everything away. This is another way we're going to retrieve the bedpan from Mrs. Ellie. I'm going to retrieve the bedpan from Mrs. Ellie. Okay, I'm going to ask her to bend her knees. Levez genou. Okay, and I'm going to get the bedpan. Lift for me. Okay, thank you. Make sure I throw whatever I need to throw away in the respective area. I wash my basin. I dry my basin and put it away. I'm going to provide privacy. All right, Mrs. Ellie had already cleaned herself. Mrs. Ellie, I'm going to put your head back up. Is that okay? Okay. All right, Mrs. Ellie, here's your call bell. If you need anything, you can call me. All right, make sure hand washing is completed. Hand washing is required. I'm going to open the curtain. And Mrs. Ellie, if you need anything, you can give me a call, press the call bell, and I'll come help you, okay? Whatever Mrs. Ellie did in the bedpan needs to be emptied in the commode, in the toilet, and the basin needs to be washed. After you wash the basin, you need to ou besoin essuyer bassin parce que ou pas ka mettre bassin tout sale côté le sorti a. L'on fin laver et l'on fin essuyer, jeter sac dans bassin, ou rester laver de l'eau ou laver et puis les fin essuyer et vous mettez dans un côté ou supposé mettre dans nightstand patient, dans nightstand résident. L'on fin fait toute bagaille net ou make sure ou laver mon et pour entrer ou tourner back côté patient et pour dire evaluator my skill is completed. So make sure the patient's bed is down in a low position. Remember, before we started, our wheels were locked, everything was locked. Make sure when we're finished, the patient goes to a bed goes to a low position, and then our wheels are also locked. We open the curtains for the patient, we thank the patient, and then we give the patient the call light, okay? Skill sa complété, n'a pas dans un lot skill, dans un lot vidéo, all right?